Hey everybody, I'm Jonathan Kaplan, board certified plastic surgeon in San Francisco at Pacific Heights Plastic Surgery. I'm also at Real Dr. Bae, RealDrBae on Snapchat, Instagram, and TikTok. I want to talk to you about four things today. First, these particular antibody tests and whether they're approved by the FDA or not. Secondly, we're going to talk about theoretically how serologic or antibody tests work. Third, we're going to talk about actual tests, the actual results of these tests. And then fourth, we're going to talk about how we're going to use them in our office. So first, as far as FDA approval, these are approved by the FDA under the emergency use authorization. Now that doesn't mean that they're fully approved by the FDA. It doesn't mean that the FDA has looked at all their data yet. They are in the process of looking at their data, but they're allowing them to be sold in the United States and sold to healthcare professionals like myself. They're allowed to be sold while they're doing the evaluation at the FDA. They have the data, but they just haven't fully vetted them and validated them yet. And so it's kind of a balancing act the FDA is running right now. Is the thing is that, Americans want something right now, but it takes a really long time to fully vet these. So instead of the FDA saying we're not going to allow any of them to be sold until they're fully vetted, we'll allow them to be sold while we're vetting them under that emergency use authorization that I was talking about. So keep that in mind, that we may find out down the road that these tests aren't perfect, but we do, that being said, we do have the data so far that the FDA is evaluating. And so that data is that if you have this antibody test early on in the coronavirus process, if you actually have the disease and you get this antibody test, this test will show that you have it early on 87.9% of the time. So saying that 87.9% of the time, if you have it, the test will show that you have it. That also means that 12.1% of the time that if you have it, the test won't show that. So that is concerning, that 12.1% of the time you may not test positive even though you do really have it. But that's also why you don't always just take the test by itself. You combine that with the history. You talk to the patient. Are they having fever? Have they been around people with coronavirus? So you take all that history into account and combine that with the testing. Now, if you truly don't have the disease, this test will not say that you do have the disease. So there's not going to be any false positives. That's the specificity of this test, that it's 100%. So if you truly don't have the disease, this test will not show that you have the disease. Later on in the disease process, it picks up a different antibody, and we'll get into all the antibodies in a second. But if you take this test and later on in the disease, that it shows that 97.2% of the time, this test will show that you have those antibodies later on in the disease. So that's really good. It'll show you that if you had it, if you're recovering, this test will show that. So it is a very useful test. It's the best thing we have right now as far as a quick, rapid test. It takes 10 minutes to take. So that is good. If other better options come out, then we may switch to those. And also we'll wait and see what the FDA says. But the data is out there and the FDA is evaluating it. But right now it is legal for us to be purchasing and using these tests in the United States. So now I want to talk about how these tests work theoretically. So what we're testing for are antibodies, or immunoglobulins. And antibodies are these proteins that develop in your bloodstream in response to a virus or a bacteria. And so what those antibodies do is they act as a kind of a neon sign that attaches to the virus or the bacteria to say, hey, white blood cells, these particular viruses or bacteria shouldn't be in here. They're foreign invaders. Come and attack them. So that's what antibodies do. So if you have antibodies, then you can have a quicker response to if you get a reinfection potentially and tamp down that infection. So anyway, this is a graph that shows the number of days from onset of after you've been exposed to the coronavirus. And here's the incubation period where you're not sick yet. The viral load is starting to grow in your body, and then you start to show symptoms. And some people, of course, are asymptomatic, but this is potentially where you're going to start to get a fever. And then this is what the first antibodies you're going to have to start to rise in your bloodstream are the IgM antibodies. So you're starting to see these come up here, and then after about 7 days you start to see a rise in this green line, which is the IgG antibodies. So what you're basically able to see is that while you have a peak of the IgM, that means you're early on in the infection, and when you have a peak of the IgG, that means you're later on in the infection. And when you get to the point where you only have IgG in your bloodstream, then that means you are recovering, and this is what provides you the immunity. So in this area, you're actively infected, you've got both IgM and IgG. At this point, you've recovered, you still have the IgG, that means you're immune. As far as how immune you are, that could be anywhere from 2 to 8 years. It's still too early to tell with this particular disease. Now you'll notice that with this test, that during this incubation period, there's no IgM, no IgG, and so this test wouldn't be positive. That's not really a shortcoming of the test. That's really just how serologic tests like this work.
For example, think about a pregnancy test. If you do the hibbity-dibbity the night before and then you take a pregnancy test, it's not going to show that you're pregnant yet. No, people wouldn't think that that's necessarily a failing of a pregnancy test. That's just the way it is. So you do have to have somewhat of a viral load. You have to start to have a response by your body to develop these immunoglobulins and to see a result with this test. But again, that's why you take it into account their history, whether they're feeling like they're feverish or they've been around people with coronavirus. So now on to the third topic, I want to highlight the actual test. This is what the test looked like. It does look a little bit like a pregnancy test. And the way it works is you drop a little bit of your blood, a little finger prick, you put a little blood right here into this well. Then you put this buffering solution down into this well, and then that diffuses up, captures the immunoglobulins or the antibodies that are in the blood, and then carries them along the strip. And this is the control that just shows that the buffering solution has made it all the way here. So normally this is, to start, this is blue, and then it turns red, showing that the buffering solution has made it all the way. So this just proves that the test is working. It goes from blue to red. So we know this test has worked so far, but notice there's no IgM line, there's no IgG line. So that means this person has never been exposed to the coronavirus. So that's good. That's why the emoji is very happy. This person put in the buffering solution, grabs the antibodies from the blood, and it's pretty cool how it actually shows you temporally how this first, the first thing you would get is the IgM, then you get the IgG, and that's actually how it's placed on the strip. So you'll notice that there's really not a very strong IgM, maybe a very faint line, but maybe none at all, but very strongly IgG, and it's gotten to the control, turned it from blue to red, so you know the strip has worked. Now, what does this mean? So then we go back over to this graph, and it makes perfect sense. There was no IgM, but there was a very high IgG. So where in this area is there a high IgG and no IgM? And that's right here. And so that means this person is recovering, and they're not in the active phase. And I happen to know that this particular person, that they had the coronavirus a couple months ago, so they have had the disease and now they've recovered, and so it makes perfect sense that they would only have IgG now. So it's very helpful, because most coronavirus tests, they either say you have the coronavirus or you don't. That's not a whole lot of information. This is very helpful because we know they've had it, and now we know they're fully recovered and they're immune currently. Now we take a look at this example. Put in the buffering solution, grabs the antibodies, makes its way up, and you'll see that it's very strongly IgM, very faintly IgG, and that's turned from blue to red, so we know it's working. So let's take a look here at the graph. Where is it that IgM is very strong and IgG is very weak? Right here, IgM is very strong, IgG is very weak, so you know that this person is early on in their disease process, and I happen to know the history with this patient. They are just at the beginning of their infection, which is why they have this feverish emoji. So very helpful information. Let's take a look at another couple examples here. This person, they put the buffering in the well, grabs a few antibodies. IgM is very slightly positive. IgG is very strong. The controls turn from blue to red. You know it's working, and so we're an example of that. Whereas IgM very light and IgG is very strong right here. So this person is still infected, but they're in the recovery portion where they're getting ready to be completely out of that zone, completely recovered, but they're not there yet. So they're right here where the IgG is strong, IgM is weak. And you look at this person, they have neither IgM or IgG, so they've never been exposed. So very helpful information. And so that's kind of how we're going to be using it in our office, is that patients who come in for surgery, it's not a surprise that surgery can be a stressor on a body. So if you are potentially at the early stages of being sick, surgery could make you sicker if you have the virus, and so we obviously don't want to operate on somebody like that. So when you're looking at this graph, we are not going to operate on anybody in between these areas right here, in between this line and this line. If you're just starting to get feverish, you have IgM. If you're in the sickest part of the disease, where you have IgM and IgG, we're not going to be operating on people like this. We would only operate on people who have no history of being around coronavirus patients, have no IgM antibodies, as in here, or before they get the IgM antibodies. People who are out here who have just IgG, strongly IgG, and absolutely no IgM, we would operate on people like that, because that means they're in the recovery phase. So that's really how we're going to use it. It's a 10-minute test. We'll do it every morning before an operation, before the patient goes back in the operating room, just like we do pregnancy tests. We'll do that. And we'll just want to make sure the patient is healthy. Again, ask about their history, make sure they're not having a fever, make sure they haven't been around a lot of coronavirus people or any at all. And we just want to make sure the patient is healthy as possible.
And this is a great adjunct to make sure that they really are healthy, that we have some documentation that they either are strongly IgG, meaning they're immune, or they have no antibodies and they're not in the throes of the illness. So if you have any questions, please comment below. Thanks so much for listening. Hope you enjoyed that. Hopefully you learned something.